Welcome to Module 2, Exploring Prevalent Psychological Challenges. Mental health conditions are common, affecting 1 in 4 people annually in the UK. Understanding these is crucial for all professionals. Today, we'll examine anxiety disorders, depression, stress-related conditions, and trauma, focusing on recognition, underlying causes, and implementing effective support strategies. The module provides a comprehensive examination of mental health disorders that significantly impact our communities. We'll explore how these conditions manifest, their underlying causes, and most importantly, how we can create supportive environments. Our approach emphasizes early recognition because timely intervention dramatically improves outcomes. We'll also address the persistent stigma surrounding mental health, which often prevents people from seeking help when they need it most. This module equips you to recognize mental health challenges, identify key symptoms, and understand their complex biopsychosocial causes. You'll also learn how these conditions impact individuals, workplaces, and communities, providing a holistic view for better support. We'll cover 4 major mental health challenges: anxiety, depression, stress, burnout, and trauma, PTSD. Anxiety disorders are globally common. Depression is a serious medical condition with profound impacts. Stress and burnout are increasingly prevalent in demanding environments. Finally, trauma and PTSD result from overwhelming events, requiring specialized understanding and support. We will also discuss stigma reduction. Anxiety disorders are characterized by excessive fear and worry that interferes with daily functioning. Unlike normal anxiety, which serves a protective function, anxiety disorders involve persistent, overwhelming responses that are disproportionate to actual threats. These conditions affect approximately 8 million people in the UK, making them the most common mental health disorders. The key distinction is that anxiety becomes problematic when it prevents people from engaging in normal activities or causes significant distress. Anxiety disorders manifest in several distinct forms. Generalized anxiety disorder involves persistent worry about multiple life areas, making it difficult for individuals to control their anxious thoughts. Panic disorder features sudden, intense episodes of fear, accompanied by physical symptoms like rapid heartbeat and shortness of breath. Social anxiety disorder causes overwhelming fear in social situations, often leading to avoidance behaviors that significantly impact personal and professional relationships. Each type requires tailored approaches for effective management. Anxiety manifests through interconnected cognitive, physical, and behavioral symptoms. Cognitive symptoms include persistent worry, racing thoughts, and difficulty concentrating. Physical symptoms often include rapid heartbeat, sweating, trembling, and gastrointestinal distress. Behavioral symptoms typically involve avoidance of feared situations, restlessness, and seeking excessive reassurance. Understanding this symptom cluster helps in early identification and appropriate intervention. Symptoms can vary significantly between individuals and may fluctuate in intensity. Anxiety disorders stem from a complex interaction of biological, psychological, and social factors. Biological aspects include genetics and neurochemical imbalances. Psychological factors involve negative thought patterns and poor coping. Social factors cover trauma and life stressors. Recognizing this multifactorial basis is crucial for comprehensive treatment, addressing all contributing elements. Anxiety is a common mental health challenge that can significantly impact daily life. Evidence-based interventions like cognitive behavioral therapy, mindfulness, exposure therapy, and medication are effective. Crucial self-management strategies include regular physical activity, good sleep hygiene, breathing techniques, and limiting caffeine/alcohol. These self-care practices complement professional treatment for a holistic approach. The key is finding the right combination of strategies for each individual. Depression is a major global mental health challenge, impacting over 280 million people. It's a persistent condition, distinct from temporary sadness, that significantly alters how individuals think, feel, and function. It can be episodic or chronic, affecting all demographics and extending its impact to families and communities. Early recognition and intervention are crucial for effective management and preventing long-term complications. MDD, persistent sadness for 2+ weeks, affects daily function, impacts approximately 1 in 6 UK adults. PDD, chronic depression, 2+ years, less severe but enduring, often starts in youth. Seasonal depression, autumn-winter, affects approximately 2 million in the UK. Distinguishing these types aids proper diagnosis and treatment. Depression diagnosis needs specific criteria. Primary symptoms: persistent low mood and anhedonia, loss of pleasure. At least 4 additional symptoms required: changes in appetite, sleep, fatigue, concentration issues, worthlessness, or suicidal thoughts. Symptoms must last at least 2 weeks and impair daily function, ensuring accurate diagnosis and treatment. Depression arises from a combination of genetic, psychological, environmental, and social factors. Family history, neurotransmitter imbalances, and hormonal changes increase biological risk. Negative thought patterns and low self-esteem are psychological factors. Childhood adversity, trauma, and chronic stress are environmental influences. Social factors include isolation and relationship difficulties. Understanding these factors is essential for effective prevention and intervention strategies. Managing depression effectively requires a combination of evidence-based treatments like psychotherapy and medication, often combined for better results, especially in severe cases. Additionally, lifestyle changes such as regular exercise, healthy sleep patterns, social connection, good nutrition, and nature exposure significantly support long-term management. These strategies improve overall well-being and reduce depressive symptoms. Stress is a natural response to pressure, but chronic stress can lead to burnout. Burnout is characterized by emotional exhaustion, depersonalization, and reduced personal accomplishment, often from prolonged stress without recovery. Understanding this continuum is crucial for effective prevention and management strategies at both individual and organizational levels. The stress response is a natural, adaptive mechanism that prepares the body to face immediate threats. This fight-or-flight response increases heart rate, blood pressure, and energy levels, while suppressing non-essential functions. However, when stress becomes chronic, it can lead to maladaptive changes, including immune system dysregulation and increased risk of health issues. Understanding the transition from adaptive to maladaptive stress responses is crucial for developing effective stress management strategies. Burnout evolves through distinct stages. It begins with the honeymoon phase, where initial enthusiasm might hide early stress signals. As stress intensifies, it moves into the stress onset stage, marked by fatigue and frustration. Without intervention, this can escalate to full burnout, characterized by emotional exhaustion, depersonalization, and reduced accomplishment. Early recognition of these stages is crucial for timely intervention and preventing long-term consequences. Burnout is characterized by 3 dimensions: emotional exhaustion, depersonalization, and a reduced sense of personal accomplishment. Emotional exhaustion leaves individuals feeling drained and unable to cope. Depersonalization involves developing negative attitudes towards work or clients, often as a defense mechanism. Finally, a reduced sense of personal accomplishment can lead to feelings of ineffectiveness and dissatisfaction. Addressing these dimensions is key to effective burnout prevention and recovery. Effective stress management involves addressing physical, psychological, and social well-being. Regular physical activity, adequate sleep, and balanced nutrition are foundational. Mindfulness meditation and cognitive reframing help manage psychological stress. Building a supportive social network and setting clear boundaries enhance social well-being. These strategies collectively reduce stress and promote resilience, enabling individuals to cope better with life's challenges. Trauma can have profound effects on mental health, leading to conditions like PTSD. Key symptoms include reliving the trauma, avoidance of reminders, negative changes in mood, and heightened arousal. Diagnosis requires symptoms to persist for over a month and cause significant distress. Understanding these symptoms is crucial for effective intervention and support, helping individuals navigate their recovery journey. Trauma comes in diverse forms beyond single events. Developmental trauma stems from prolonged childhood adversity, impacting development and relationships. Collective trauma affects entire communities through shared experiences like war or natural disasters, shaping identity and resilience. Recognizing these forms is crucial for tailored support. PTSD is a serious mental health condition that develops after a traumatic event, affecting around 4% of UK adults annually. Its main symptom clusters are re-experiencing, e.g., flashbacks, avoidance of reminders, hyperarousal, e.g., hypervigilance, irritability, and negative alterations in mood and cognition. Understanding these symptom groups is key for effective recognition and addressing of PTSD. Realize, acknowledge trauma's widespread impact on brain, body, and behavior. Recognize, identify trauma signs in clients and staff, understanding underlying causes beyond difficult behavior. Respond, integrate trauma knowledge into policies and practices to foster safe environments and prevent re-traumatization. Resist re-traumatization. Actively prevent re-traumatization by promoting choice, control, trust, and transparency. Evidence-based trauma treatments are the focus of this presentation. We'll cover two key first-line psychological interventions: trauma-focused, CBT, and EMDR. Trauma-focused CBT addresses trauma-related thoughts and beliefs using controlled exposure to trauma memories. EMDR facilitates processing of traumatic memories through bilateral stimulation while recalling the trauma. We'll also touch on additional approaches like pharmacotherapy, somatic therapies, and group therapy. The overarching goal of trauma recovery is not just symptom reduction, but building resilience, meaning, and connection. The slide emphasizes that trauma-focused psychological interventions are recommended as the first-line treatment for PTSD by NICE guidelines. This introduces early warning signs and stigma reduction, with the image showing community mental health support. The title and subtitle highlight the importance of recognizing early signs and fostering understanding to build supportive communities. The key message is that by addressing these two areas, we create inclusive and empathetic environments for those with mental health challenges. The overall goal is proactive mental health support and acceptance. Early intervention can make a big difference in improving outcomes for mental health conditions. Today, we'll look at the key warning signs to watch out for. The first category is emotional signs. Things like persistent sadness, excessive worry, mood swings, feeling hopeless or emotionally numb. Next are cognitive signs: difficulty concentrating, racing thoughts, memory problems, confusion. Behavioral changes are also important warning signs: social withdrawal, sleep or appetite changes, loss of interest in activities, increased substance use. And physical signs can include unexplained aches, fatigue, digestive issues, neglect of personal care. It's important to remember that these signs need to be persistent and represent a change from the person's normal baseline. Recognizing these early warning signs can allow for earlier intervention and better outcomes. Mental health stigma takes many forms: public, self, and institutional. Public stigma: negative attitudes by the general public towards those with mental health conditions. Self-stigma: internalizing negative beliefs, leading to shame, low self-esteem, and reluctance to seek help. Institutional stigma: systemic policies limiting opportunities for people with mental health conditions. Stigma's impact includes delayed help seeking, treatment non-adherence, social isolation, discrimination, and reduced quality of life. In the UK, nearly 90% with mental health problems report negative effects from stigma and discrimination. Mental health stigma is a significant barrier to people seeking help and living full, healthy lives. Today, I'll share 5 key strategies we can use to reduce stigma and create a more compassionate, inclusive society. First, we should use person-first language, saying person with schizophrenia rather than schizophrenic. This keeps the focus on the individual, not just their diagnosis. Second, we need to educate about mental health, sharing accurate information about causes, prevalence, and effective treatments. This helps challenge myths and misconceptions. Third, we should promote contact and connection. Creating opportunities for meaningful interaction with people who have lived experience can humanize mental health challenges. Fourth, we must advocate for policy change, supporting parity between physical and mental health care, and challenging discriminatory practices. Finally, we all need to model compassionate responses. Demonstrating empathy and creating psychologically safe environments can go a long way. By changing the way we talk about and approach mental health, we can work to change the culture and reduce stigma. This uses a real-world scenario to show how to apply stigma reduction principles in the workplace. It illustrates a 4-step process: noticing signs of stress, empathetically approaching the colleague, actively listening, and supporting them in seeking help. This emphasizes the value of early intervention, open communication, and creating a safe environment where colleagues feel comfortable asking for assistance. Ultimately, following these steps fosters a more supportive and compassionate workplace. Mental health is a collective journey. We all have a vital role in creating a more supportive and understanding world. Approach others with empathy and compassion, recognizing that everyone's mental health journey is unique. Help break the silence around mental health by initiating and participating in open, honest discussions. Foster environments where individuals feel safe, valued, and empowered to seek help when needed. Lead by example in maintaining your own mental well-being to sustain your capacity to support others. As Peter Drucker said, "The best way to predict the future is to create it." Each of us can play a part in shaping a future with better mental health outcomes. This slide presents 5 key takeaways. Understanding core mental health challenges: anxiety, depression, stress, trauma. Recognizing and addressing workplace burnout. Mastering empathetic communication for support. Fostering supportive and psychologically safe environments. And appreciating the impact of public health messaging on awareness and stigma reduction. These provide foundational knowledge and actionable insights for addressing mental health challenges. We've covered important ground today on reducing stigma, promoting resilience, and sustainable mental health support. Let's reflect on how to apply these insights in our daily lives and communities. First, what practical steps can we take to challenge mental health stigma in our social circles and professional environments? This is crucial for creating more open attitudes. Beyond individual coping mechanisms, how can communities and workplaces foster environments that promote mental resilience for all? Identifying systemic support is key. Considering sustainable management approaches, which strategies are most crucial for long-term mental health support at a societal level? We need holistic solutions. Your insights are valuable as we build more supportive mental health landscapes. I look forward to your thoughts. Thank the audience for their engagement and participation. Emphasize how their involvement and thoughtful questions contributed to the session's success. Encourage continued engagement in future discussions. Express appreciation for their time and attention. Invite them to reach out for additional questions or feedback. Provide a positive and uplifting closing to the presentation.